Welcome to the Oklahoma Low Back Pain Today, patient-centered education podcast. This podcast is a production of the Spine and Joint Treatment Specialists at Elite Pain and Health, a leading independent Oklahoma spine and joint specialist treatment clinic. This episode is produced and directed by Dr. Keley John Booth, MD, and provides valuable insights for patients wanting to learn more about lumbar or low back pain. All information is for educational purposes only and should not be used in place of an evaluation with an experienced licensed medical professional. You can reach out to Elite Pain and Health at epainhealth.com or call 405-444-7246 for more information. So today we're getting into something that I think is, it's just incredibly frustrating for a lot of people. It's that nagging ache you think is your hip.
Exactly. You treat the hip, you stretch the hip, but the pain, it just doesn't go away. We call it the chameleon of back pain.
And it turns out that for maybe 15 to 30% of people with lower back pain, the real problem isn't the back or the hip at all.
Right. It's the sacroiliac joint, the SI joint.
Let's break that down. The SI joint, it's basically where your spine connects to your pelvis.
That's it. I like to think of them as foundation posts. You have the frame of the house, which is your upper body, and your legs are the ground. The SI joints are what connects the two.
So they're built for stability, not for motion.
Absolutely. Your knee, your elbow, they're supposed to bend and move. The SI joint is only meant to move a tiny, tiny amount, maybe 2 to 4 degrees. It's a shock absorber.
And when that stability is off, even a little, that's where the pain comes from.
It's a huge source of pain, and you see it a lot, especially here in Oklahoma. You've got folks doing hard physical labor.
Farm work, oil fields.
Yeah, but also pregnancy is a big one. The ligaments all loosen up. And then there's the classic fall.
A slip on the ice in January. That happens all the time.
That direct impact is a major cause. It just creates this inflammation in a joint that's not supposed to be inflamed.
Okay, so the symptoms. This is the tricky part because it can feel like so many other things.
It really can. But the classic sign is a deep, dull ache, usually just on one side, right in the buttock.
And people always say hip, but it's not the hip joint.
No. True hip arthritis usually hurts in the groin area. And sciatica, that shooting electric pain, that typically goes down past the knee.
SI joint pain doesn't do that.
Very rarely. It likes to stay in the buttock, maybe the upper thigh, and it hates transitions.
What do you mean by transitions?
Getting out of a car,
yeah,
that single leg pivoting motion, or climbing stairs, even just rolling over in bed can be excruciating for some people.
Wow. So if rolling over in bed wakes you up, that's a pretty big clue.
It's a huge clue. Now, we do have to mention the red flags. There are some things where you need to go to the ER immediately.
Right. If you ever lose control of your bladder or bowels.
Or get that saddle anesthesia, a numbness in the groin area. Or if your leg suddenly becomes weak, that's an emergency.
Good to know. But assuming it's not an emergency, how do you actually figure out if it's the SI joint?
Well, that's the detective story. An X-ray or an MR might look completely normal.
Which is so frustrating for patients. They feel the pain, but the scan says everything is fine.
Exactly. So the real gold standard is a diagnostic injection.
So you're actually putting medicine into the joint to see what happens.
We put a numbing medicine, a local anesthetic, directly into the joint. And we use a live X-ray called fluoroscopy to guide the needle.
So you know you're in the right spot.
Precisely. And if your pain goes away by, say, 50 to 75% while you're numb, well, we found our culprit.
That must be such a relief just to finally have an answer.
It turns a guessing game into a firm diagnosis. And from there, the treatment plan is usually very successful without surgery.
That's the best part. Surgery is really the last resort.
For almost everyone, conservative care is the answer. We start with physical therapy that focuses on stabilizing the pelvis.
Tightening the bolts on those foundation posts.
Perfect analogy. But if that and anti-inflammatories aren't enough, then we move to interventions.
And that's where things like radiofrequency ablation come in, the RFA.
Yes. It sounds complex, but the idea is simple. We use heat from a special needle to basically stun the little sensory nerves that carry pain signals from the joint.
So you're not fixing the joint, you're just turning off the alarm bell.
You're cutting the phone line so the brain doesn't get the pain signal. That alone can provide relief for 6 months, sometimes more than a year.
And then there are things like PRP, regenerative options.
Right. Using your body's own healing factors to help support the tissue. It all just shows how critical that first step is.
The diagnosis.
Because if you spend years treating the lumbar spine when the real problem is the pelvis, you're just not going to get better.
We hope this episode helped you understand buttock and hip pain. If you're experiencing these symptoms, you don't have to live with pain. The specialists at Elite Pain and Health are here to help. Visit epainhealth.com or call 405-444-7246. Thank you for listening to Oklahoma Low Back Pain Today. Take care of your spine, Oklahoma. We'll see you next time.